Well, despite an interim interdict halting that strike, some clinics remained closed in the city. The Tshwane Health MMC, Rina, Marx, says it's due to threats made to non-striking staff. She joins us now for more on this issue. So, Rina, Samwu, of course, has a very different view of this protest. In fact, they say that the intimidation the city is speaking about simply does not exist. What is it that your employees have reported to you?
It does exist. I can just say good evening. Thank you for having me. We've got 24 clinics that are administered by the city of Tshwane. All these clinics are a comprehensive package of healthcare services. These clinics has been affected the past week already by strikers. I can just tell you, some of these clinics, we've got a comprehensive package of healthcare services. These include women's health, child health, HIV, AIDS, TB and STI treatment, basic antenatal care, curative services, pharmaceutical services and chronic disease services. Firstly, the forced closure of our clinics due to the illegal strike has basically resulted in community members being denied access to these critical services, which is a basic human right protected by our constitution. Secondly, it has placed added strain on the clinics that are operational as staff have to cater for more patients who have been redirected there. Our clinics do not operate on 24-hour basis. As such, higher patient numbers at clinics have resulted in patients not being attended to on the same day. The impact has been far-reaching at places. An additional strain on all clinics, but more importantly, patients are not receiving the quality services and attention that they deserve.
It's absolutely concerning that, of course, patients are the ones that suffer. Speak to me, Rina, more specifically. What has happened with the intimidation? What is being reported by your employees? How are they being intimidated?
Okay, I can tell you, during the course of last week when the illegal strike started, the Littleton, Forlang, FF Ribera, Hercules, Karen Park and the Roslyn clinics were forced to close. As of today, the same clinics remain affected and were forced to close due to security concerns. Intimidation has been in the form of illegal strikers entering the clinic premises, forcing staff and patients out of the clinics. Some of our nursing staff has received direct threats not to open the clinics. We received a number of reports just this morning that this was occurring at the mentioned clinics. Last week on Friday, a security guard was assaulted at the FF Ribera clinic. Some staff are so traumatized that we even have to provide trauma counseling now. The situation also is very traumatic to our patients witnessing these events.
Are you keeping a record, Rina, of all of these incidents? I would imagine that this is incredibly helpful, especially when it comes to trying to hold these employees accountable for their actions, because surely there must be some kind of disciplinary process that will follow from this.
Yes, as you know, the city obtained a court order interdicting the strike. Just today, the executive mayor and the city manager pronounced very strongly on the violation of the court order by striking workers. Given the open defiance of the court order and continued intimidation of staff and patients, we will have to rely on law enforcement to ensure safety of those using our clinic facilities. Let me say that while we are sensitive to the plight of our workers, we strongly condemn acts of intimidation against our staff and the patients. It is unacceptable that patients are denied basic human right, which is access to health care. And yes, the city, both the mayor and the city manager, are taking very strong acts against these violation of the court order.
So what must patients do now? Many of those that would need access to your facilities would also be on chronic medication, and of course we know time is important when it comes to how long some of these patients can go without their medication. What is your advice to some of them tonight?
Yes, it's extremely concerning, but these patients are advised to go to other clinics at nearby facilities where they can get their chronic medication. So it is really, and the nursing staff also direct them to other facilities to get their medication.
All right, let's leave it there for tonight. Rina Marx is the Tshwane Health MMC.